First of all, everyone out there knows, whether you be a dentist, a physician, or a patient, that the science behind migraine headaches, good attempts, good scientists, no criticism of a scientist trying to find a solution to a problem, but all the good articles, all the good scientific articles on the issue of migraine headaches will admit they have no idea what causes migraine headaches. So you have out there in the United States of America and worldwide, at least in the developed countries in the world, you have a cadre of doctors who can't define migraine headaches because they don't know what causes migraine headaches. You can't define a disease unless a disease well and define it correctly if you don't know the cause. I mean, for example, heart disease, heart attacks, myocardial infarction. You don't define the disease as the symptoms of the disease. Now, you can talk about the disease as the symptoms. The symptoms of a heart attack would be, you've already heard it, oppressive chest pain, feels like bands across the chest, radiating into usually the left arm. If it's the LAD, it'll radiate into the left arm. But those are symptoms. But you can't define a heart attack, myocardial infarction, unless you define what causes it, which is obstruction, a closing off obstruction of a coronary artery. That is the definition of a myocardial infarction.